Hi there, future special educator. Welcome to your study guide for the NES 602 Special Education exam. This video is going to walk you through everything you need to know for the first two domains of this exam. We'll cover the exam format, then deep dive into Domain 1, Foundations of Special Education, and Domain 2, Assessment, Learning Environment, and Individualized Planning. Together, these two domains are worth 50% of your exam. Let's get started. Before we dive in, we put together a free study guide workbook that goes along with this video. It has all the key terms, comparison tables, practice questions with detailed answer explanations, and space for your own notes. Grab your free copy from the link in the description below. This video is presented by TeacherPreps.com, where we offer complete study guides, full-length timed practice tests, vocabulary exercises, and constructed response practice for dozens of teacher certification exams. It's free to get started. Alright, that was our plug. For the rest of this video, it's go time. Grab your pen and paper. Let's start with the exam format. The NES 602 Special Education K-12 exam has 100 multiple choice questions, and you get 2 hours of testing time, plus an additional 15 minutes at the beginning for the tutorial and non-disclosure agreement. No reference materials are allowed. That gives you about 72 seconds per question, so you have a reasonable amount of time to read each scenario carefully. The exam is divided into 4 content domains. Domain 1, Foundations of Special Education, is approximately 20%. Domain 2, Assessment, the Learning Environment, and Individualized Planning, is the largest at approximately 30%. Domain 3, Instruction, Social-Emotional Learning, and Communication, is also approximately 30%. And Domain 4, Collaboration and Professional and Ethical Practices, is approximately 20%. In this video, we'll deep dive into Domains 1 and 2, which together account for half of your exam. Let's begin with Domain 1. Domain 1, Foundations of Special Education. This domain is worth approximately 20% of your exam. It tests whether you understand the historical, philosophical, professional, and legal foundations of special education, as well as human development and how different disability characteristics affect students and their families. Let's start with the most important law you need to know, IDEA, the Individuals with Disabilities Education Act. IDEA has 6 core principles, and you should memorize all of them. First, free appropriate public education, or FAPE. This means every eligible student with a disability receives special education and related services at no cost to the family. Second, least restrictive environment, or LRE. Students must be educated with non-disabled peers to the maximum extent appropriate. Removal from the general education setting only happens when supplementary aids and services can achieve satisfactory results. Third, appropriate evaluation. A full individual evaluation must use multiple tools and strategies. No single test determines eligibility. Fourth, the IEP, the Individualized Education Program. This is the written document that spells out present levels, goals, services, accommodations, and placement. Fifth, parent participation. Parents are equal members of the IEP team and must give informed consent before evaluation and initial placement. Sixth, procedural safeguards. These are legal protections including prior written notice, access to records, mediation, and due process hearings. Now let's compare 3 federal laws you need to distinguish on test day. Section 504 is a civil rights law that prohibits discrimination based on disability in any program that receives federal funding. It uses a broader definition of disability than IDEA. A student who doesn't qualify for an IEP may still qualify for a 504 plan. The ADA, the Americans with Disabilities Act, is another civil rights law that ensures access and reasonable accommodation in public life. Then there's IDEA, which is an education law that provides federal funding and guarantees a free appropriate public education through an IEP. Here's the key distinction. Section 504 and the ADA are about access and non-discrimination. IDEA is about providing specialized educational services. On test day, if the question asks about eligibility for special education services, the answer involves IDEA. If it asks about access and accommodation without specific special education services, think Section 504. 2 more concepts for Competency 0001. Universal Design for Learning, or UDL, is a framework with 3 principles. Multiple means of engagement addresses the why of learning through motivation and self-regulation. Multiple means of representation addresses the what of learning through different ways of presenting information. Multiple means of action and expression addresses the how of learning through different ways students demonstrate what they know. Next, you must distinguish accommodations from modifications. An accommodation changes how a student learns or demonstrates knowledge without changing the curriculum standard. Examples include extended time, audio textbooks, and preferential seating. A modification changes what the student is expected to learn, altering the curriculum standard itself. Examples include simplified reading passages and reduced answer choices. On test day, if the question asks what maintains grade-level standards, the answer is an accommodation, not a modification. Know the difference between an IEP and an IFSP. The IEP is for students ages 3 through 21. It's student-centered, school-based, and reviewed at least annually. The IFSP is for infants and toddlers birth through age 2. It's family-centered, delivered in natural environments like the home, and reviewed every 6 months. The IEP team is led by an LEA representative, while the IFSP process uses a service coordinator. When a child on an IFSP turns 3, there must be a transition plan to move from Part C early intervention services to Part B school-age services. On test day, if the question involves a child under 3, think IFSP. If the child is 3 or older, think IEP. Now let's move to human development and disability characteristics. You need to know 6 developmental domains. First, adaptive and self-help, daily living skills like dressing, feeding, and hygiene. Second, cognitive, problem-solving, memory, attention, and concept formation. Third, social-emotional, peer relationships, self-regulation, and empathy. Fourth, sensoromotor, sensory processing, and fine and gross motor coordination. Fifth, physical, strength, stamina, mobility, and health conditions. Sixth, communication, receptive and expressive language and pragmatics. Remember, development across these domains is interconnected. A delay in one area often affects other areas. A student with a communication delay will likely struggle with social skills because peer interaction depends on language. IDEA defines 13 disability categories. You need to know all of them, but the ones most frequently tested include specific learning disability, which is a disorder in psychological processes affecting reading, writing, math, or listening. Autism, which affects verbal and nonverbal communication and social interaction with onset before age 3. Emotional disturbance, which includes conditions like anxiety, depression, and inappropriate behavior over a long period. Intellectual disability, characterized by significantly below-average intellectual functioning with adaptive behavior deficits. Other health impairment, which covers limited strength, vitality, or alertness due to conditions like ADHD, epilepsy, or asthma. And speech or language impairment, which includes articulation disorders, fluency problems, and language impairments. The critical testing point: a student must have an identified disability under one of these categories, and the disability must adversely affect educational performance to qualify for IDEA services. Etiologies or causes of disabilities. Know the 4 timing categories. Genetic causes include chromosomal conditions like Down syndrome and inherited conditions like Fragile X. Prenatal causes happen during pregnancy: fetal alcohol spectrum disorder from maternal alcohol use, rubella exposure, and toxin exposure. Perinatal causes occur during birth: oxygen deprivation, premature birth, and low birth weight. Postnatal causes happen after birth: traumatic brain injury, lead poisoning, meningitis, and severe malnutrition. Environmental factors like poverty, neglect, and limited access to healthcare also increase risk for developmental delays. On test day, you may be asked to identify the timing category for a specific etiology. 2 more important topics. First, stress and trauma. Students with disabilities are at higher risk for adverse childhood experiences. Toxic stress is prolonged stress without adequate adult support, and it can alter brain architecture. Trauma-informed practices focus on safety, predictability, trustworthiness, and relationship building. Protective factors include stable relationships, caregiver resilience, social connections, and knowledge of child development. Second, family dynamics. Family systems theory says the whole family is affected by a child's disability. Families go through stages of adjustment that aren't necessarily linear. Cultural responsiveness matters because beliefs about disability and intervention vary across cultures. Siblings may experience a mix of pride, guilt, and resentment. On test day, look for answers that respect family diversity and treat families as partners, not passive recipients of professional guidance. Let's try a practice question for Domain 1. Under IDEA, which principle requires that a student with a disability be educated alongside non-disabled peers to the greatest extent appropriate? A. Free appropriate public education. B. Least restrictive environment. C. Procedural safeguards. D. Appropriate evaluation. The correct answer is B. Least restrictive environment. LRE is specifically the principle that addresses where a student is educated. FAPE ensures they receive special education at no cost. Procedural safeguards are legal protections. Appropriate evaluation governs how eligibility is determined. When you see the phrase alongside non-disabled peers or maximum extent appropriate, think LRE. Now let's move to Domain 2, assessment, learning environment, and individualized planning. This is the largest domain on the NES 602 at 30%. It contains 3 competencies: assessment, learning environment, and individualized programming. This domain tests your ability to select and interpret assessments, design effective learning environments, and develop IEPs that meet individual student needs. Let's start with assessment. Here's the essential terminology you need to know. Validity means the test measures what it claims to measure. Reliability means the results are consistent over time and across raters. A percentile rank of 25 means the student scored higher than 25% of the comparison group. Standard scores use a common scale, typically with a mean of 100 and a standard deviation of 15. Basal is the level where a student answers all items correctly, establishing the floor of ability. Ceiling is where the student misses a set number of consecutive items, establishing the upper boundary. Norm reference tests compare a student to same-age peers. Criterion reference tests measure mastery of specific skills without peer comparison. On test day, if a question asks which assessment tells you how a student compares to others, the answer is norm referenced. If it asks which tells you what skills the student has mastered, the answer is criterion referenced. Now the types of assessments. Screening is a quick, broad check to identify students who may need further evaluation. Think universal screening tools like DIBELS. Diagnostic assessment is an in-depth evaluation to determine the nature and extent of a disability. Think Woodcock-Johnson or the WISC. Formative assessment is ongoing monitoring that guides instruction, curriculum-based measurement, exit tickets, daily observations. Summative assessment evaluates achievement at the end of a period, like state tests or unit finals. Curriculum-based assessment directly measures skills taught in the student's own curriculum, making it ideal for progress monitoring toward IEP goals. Portfolio assessment collects work samples showing growth over time. The most tested distinction for IEP progress monitoring. The answer is almost always curriculum-based measurement because it's directly aligned to instructional goals and can be administered frequently. Functional Behavioral Assessment, or FBA. This is a systematic process for identifying why a student engages in challenging behavior. The core method is ABC recording. Antecedent is what happened immediately before the behavior. Behavior is the observable action, and consequence is what happened after. All behavior serves a function. The student is either trying to obtain something, like attention, a tangible item, or sensory input, or trying to escape or avoid something, like a task, a person, or sensory input. Once you identify the function, you teach a replacement behavior that serves the same function in a socially acceptable way. The FBA data leads to a behavior intervention plan, or BAP, which includes prevention strategies, the replacement behavior, response procedures, and a data collection plan. Critical test-taking strategy. The first step in addressing challenging behavior is always to collect data and identify the function. Never jump to an intervention without understanding why the behavior is occurring. Data collection methods. Frequency or event recording counts how many times a behavior occurs, best when the behavior has a clear start and stop. Duration recording measures how long a behavior lasts. Useful when you care about the length of time. Interval recording checks whether the behavior occurs during set time intervals. Good for behaviors that are ongoing or hard to count. Latency recording measures the time between a prompt and the student's response. And permanent product reviews the tangible results of behavior, like completed work samples. On test day, match the data collection method to the question being asked about the behavior. Now let's talk about the learning environment. Physical layout matters. Arrange the classroom to minimize distractions, provide clear pathways, designate quiet areas for independent work, and ensure physical accessibility. Use visual supports extensively. Schedules, labels, color-coded systems, and task cards make expectations concrete and predictable. Consider sensory needs by reducing visual and auditory clutter, providing noise-reducing headphones and fidget tools, and creating calm-down spaces. Routines and transitions reduce anxiety and challenging behavior. Provide advance warnings, like a 5-minute and 2-minute countdown before changes. Use transition objects, priming, and consistent signals every time. For student motivation, understand the difference between intrinsic and extrinsic motivation. Intrinsic motivation comes from internal drive, fostered by choice, relevance, and achievable challenges. Extrinsic motivation uses external rewards like token economies. Token economies are especially effective for establishing new behaviors, but should be systematically faded. Self-determination is teaching students to set goals, self-monitor, make choices, and self-advocate. This is critical for independence and post-school outcomes. Working with paraeducators. This is a frequently tested area. Paraeducators implement plans created by the special education teacher. They do not design instruction, make eligibility decisions, or lead IEP meetings. The teacher provides clear directions, models techniques, and gives ongoing feedback. Critically, paraeducator support should be faded over time to promote student independence. Over-reliance on one-to-one aid support can increase learned helplessness and social isolation. On test day, if a question describes a paraeducator making an instructional decision, that is the wrong answer. Now let's cover individualized programming. The IEP has several required components. Present levels of performance describes the student's current achievement and functional performance using data. Measurable annual goals are specific objectives the student can reasonably accomplish in 1 year, linked to present levels and aligned to standards. Special education services list the specially designed instruction, related services like speech, occupational therapy, and physical therapy, supplementary aids, and supports. Assessment participation states how the student will take state and district tests, including accommodations. Transition services begin no later than age 16, addressing post-secondary education, employment, and independent living. And progress monitoring describes how and when the school measures and reports progress to parents. IEP team roles. The special education teacher develops and implements the IEP, designs specially designed instruction, and monitors progress. The general education teacher provides input on curriculum access and implements accommodations. The parent or guardian is an equal partner with irreplaceable knowledge of the student's strengths and needs. The LEA representative has authority to commit district resources. The school psychologist conducts evaluations and interprets data. Related service providers deliver specialized services. And the student participates when appropriate, especially during transition planning. Every IEP team must include all required members. If a member cannot attend, the parent must provide written consent for the absence, and the absent member must provide written input. Co-teaching models. There are 6 you need to know. 1 teach, 1 observe. 1 teacher leads while the other collects student data. 1 teach, 1 assist. 1 leads, the other circulates and helps. Station teaching. Students rotate through stations taught by each teacher. Parallel teaching. The class is split in half and each teacher teaches the same content to their group, cutting the student-teacher ratio. Alternative teaching. 1 teacher works with a small group for pre-teaching or reteaching while the other teaches the rest. And team teaching. Both teachers share equal instruction, teaching together. On test day, the question will describe a classroom need and you'll pick the matching model. If the goal is reducing the ratio, think parallel. If the goal is data collection, Think one teach, one observe. Finally, the placement continuum. IDEA requires a full continuum of options from least to most restrictive. The general education classroom with supports is least restrictive. Then the resource room, where the student leaves general education for part of the day. Then a self-contained special education classroom. Then a separate school. Then a residential facility. And home or hospital instruction for medical reasons. The IEP team determines placement based on the individual student's needs, not the disability category. A student with an intellectual disability doesn't automatically go to a self-contained classroom. The team starts with the general education setting and only moves to more restrictive placements when supplementary aids and services cannot achieve satisfactory results. Practice question for Domain 2. A special education teacher is conducting a functional behavioral assessment for a student who frequently leaves their seat during independent work. The teacher should first: A. Implement a token economy to reinforce staying seated. B. Collect ABC data to identify antecedents and consequences. C. Move the student's desk to a less distracting location. D. Contact the parent to discuss the behavior at home. The correct answer is B. In an FBA, you always start by collecting data to understand the function of the behavior before implementing any intervention. A token economy and a desk move are interventions that skip the analysis step. Contacting the parent may be useful, but doesn't address identifying the function. The golden rule of FBA: understand the function first, intervene second. Great work covering domains 1 and 2. Together, those are approximately 50% of your NES 602 exam. But here's what you still need to prepare. Domain 3, instruction, social-emotional learning, and communication, makes up approximately 30% and covers evidence-based instructional practices, behavior management, self-determination, language development, and AAC systems. Domain 4, collaboration and professional and ethical practices, makes up approximately 20% and covers working with families and related service providers, transition planning, confidentiality, and professional ethics. Without domains 3 and 4, you're walking into test day with only half the preparation you need. The complete study guide covering all 4 domains, plus full-length timed practice tests and vocabulary exercises, is available right now at TeacherPreps.com. Link in the description.